Okay, we'll kick it off. Good afternoon, everyone. This is a presentation on the various about 3 key functional areas of the Department of Veterans Affairs. This afternoon, I will be presenting as a Director of Residential Program and Services, Leslie Nieves, and I have Laura Nelson that's here with me today, presenting on the healthcare center or skilled nursing level of care. And then we have Ann James that's going to be presenting on outreach and advocacy as another core function, as well as cemetery services for the Department of Veterans Affairs. So I'll go ahead and turn it over to Laura Nelson, that she'll briefly go over the healthcare center piece of it.
Thank you, Leslie, and welcome to everybody who's joining us this afternoon for Stand Down 2021. I love talking about what we do here at the DVA. And as Leslie said, my component is the healthcare facility. We are you want to go to the coordination and support slide? Yes. So in our healthcare facility, all of our patients are veterans. That is part of the criteria for entering our building. And we provide care to veterans in conjunction and in coordination with the federal VA. And I always like to point out the partnership. I think it's really important for people to understand the interface. So we have a co-managed program here in the healthcare center. And also we have a pharmacy here in the healthcare center as well. And we obtain our prescription drugs through a memorandum of understanding with the federal VA, which reduces costs to the state of Connecticut. Many people in skilled nursing facilities are paid for by Medicaid, and all of their medications are paid for by Medicaid. But for our veterans, we do work with the federal VA for reimbursement on that. All of our veterans have access to both the West Haven and the Newington VA, and many of our veterans are seen by VA doctors in both of those settings. I do like to point out that a physician's order is required, and that we have a federal VA doctor here. She works 1.5 days. Actually, it's the last bullet. She works 1.5 days a month. She's an internal medicine physician, and she helps coordinate the care between the federal VA and our state facility. One of the other really nice features that we have with the federal VA is 2 days a week. We have a psychiatrist here who's phenomenal. She's been with us for 5 or 6 years, and she works 2 full days a week, and she assists us in the management of mild psychiatric conditions. Sometimes we get calls and inquiries here for more major psychiatric conditions. That's not really in our wheelhouse, but for mild psychiatric conditions, we do an excellent job with the help of Dr. Marias from the federal VA. Next. So who are we? We're the John Levitow Healthcare Center, named after a Connecticut veteran. And we are licensed as a skilled nursing facility by the state of Connecticut Department of Public Health. And we are federally certified by multiple agencies. One is the Center for Medicare and Medicaid Services, which we'll talk about later in the presentation, also known as CMS. We're also certified by the Federal Veterans Administration. So we have a lot of people watching over us, and we appreciate their expertise. So SNFs, or skilled nursing facilities, also known as SNFs, very highly regulated industry, and regulations drive every aspect of our operation, including funding, the admissions process, reporting, staffing, medical and clinical care requirements. It's not like you can do what you want. We're under pretty strict guidance here. Go ahead. Our physical plant is beautiful. We are a 125 bed facility built, we're the most recently built skilled nursing facility, built in 2008. It's a lovely building. If anybody has never seen it, I would encourage you to join us for a tour. We have a mix of private and semi-private accommodations. All of them have their own bathrooms and showers, which is very nice. Every veteran has a smart TV at their bedside, and it adjusts to their preference. We also have an electronic medical record that's integrated with our pharmacy. It's also integrated with our fiscal department, and billing is done through those avenues. The pharmacy also has a state-of-the-art automated medication pill distribution system, and it's quite a sight. The pharmacy, we only have a pharmacy staff of 4 people, and they push out a phenomenal amount of medication every day. We have a therapy gym, and we do provide PT, physical therapy, occupational therapy, and speech therapy. Here in our gym, there's beautiful windows in the gym. It overlooks the Glastonbury Hills. And October is my favorite month to look at the views from our facility. We have a library and a computer room, and we also have Wi-Fi throughout the facility. Many of our veterans have smartphones, their own laptops. Wi-Fi is a critical component of their quality of life, especially this past year and a half, where I think many of us spent more time in our homes, and this is their home, than we did outside the home. So it was really their lifeline. Some of the highlights that I like to point out in our building, we have a beautifully appointed interfaith chapel. It does have direct access to the outside. It's convenient for celebrations and funerals. We have a lovely recreation room with a beautiful outdoor patio. Again, that patio has a beautiful view of the Glastonbury Hills. We have a healing garden that is used by many of our veterans as a place of reflection. And part of what makes our healing garden a special place is we have volunteer gardeners who are very faithful in maintaining the garden. And even more importantly, they maintain some really special relationships with the veterans in our facility that go out there and enjoy that space when the volunteers are here. And we were lucky because it is outdoors, so we were able to maintain that volunteer even when we had isolation protocols in place. Because it was an outdoor space, there's a little bit more flexibility. We have a beautiful dining room named after former Governor Jody Rell. It's referred to as the Rell Dining Room. It offers spacious dining, table service, and it's a nice social atmosphere. We have a barber shop. Nick the barber is one of our volunteer barbers who's done a fantastic job with our veterans. He's another one of those volunteers that it's not just the service that he provides, like cutting hair. He's a very personable guy and has a real affinity for our veterans. We also have a laundry facility where the veterans can do their own laundry if they wish. They don't have to. We're a full service facility. We provide that, but many of our veterans like to do their own laundry. They like that independence, and quite honestly, there's less chance for things to get lost. So it's a nice service that we have here for our veterans. Some of our specialized clinical programs, our memory care unit. The people that live on that unit typically have dementia, many Alzheimer's disease, but there's also dementias that are not Alzheimer's disease. We have a respite care program, which continues to be on hold right now. We also provide palliative and end-of-life care. And I think it's something that we do very well here in our facility. We have a chaplain who visits the veterans and tends to spend more time with the veterans who are sort of nearing the end of the road, if you will. And I feel very fortunate that Father Galasso is part of our team here. I think his presence makes a difference. We're also music and memory certified. So through our recreation department, we create actually personalized playlists for veterans. They get to select music that they like, songs that they like, artists that they like, and our recreation team puts together an entire playlist for them. And it's funny, you know, I don't know how many of you listen to music. I tend to listen to a lot of it. And it's funny, somebody can be agitated or a little bit down, not having a good day, and you can often put headphones on and be transformed into a different place and feel a lot better afterwards. And our recreation staff is very in touch with that. So that's just one of the special things that we offer through our recreation program. So what does happen here in terms of care? Any veteran who's in our building needs to be here. They have a doctor's order to be here, and they've also passed a federal required screening to come to our facility. And once that happens, we put together a very patient-specific treatment plan for each patient. And it's put together by a multidisciplinary team. The veteran is in charge of his own care. Physicians are part of that team. Nurses, our therapists, our registered dietitian, our respiratory therapist, if that's a need. Our licensed social workers are involved with every patient. Our chaplain and our nurses' aides and family members are all part of that team. And we try to put together the best type of care that will meet the needs of each veteran. And for each person, that's very, very different. So it's important we meet initially within the first few days of a person arriving here. And then we meet about a week later to sort of assess where we're going. And then we start meeting every quarter or intermittently if it's needed. And we do like to keep, like I said, that veteran at the center of those meetings because it's all about that person. And we want to make sure that we are meeting their needs. And sometimes you have to have those formal meetings to ask somebody, you know, how they're doing, what else can we do for them? Or is there something happening that they don't like? And we can make adjustments along the way. But we don't want people waiting until a meeting to, you know, make a suggestion. We want that done right away. So the team is really important, and it's a very cohesive team here in the facility. One of the things that I think sets our healthcare center apart from other sort of community-based skilled nursing facilities is we have a culture that's very veteran-centric. We honor many military historical events, such as military birthdays and other special events, Veterans Day, of course. We encourage socializing and camaraderie, and you'll see sort of small groups of veterans become friends. Maybe they served at the same time or in the same war or at the same place at different times, but they all have a lot of stories. And sometimes the best people to share those stories with are people who have walked in your shoes. And I don't think you can get that at just any nursing home, but when you come here, you'll find those people who fought the same fight that you did. And there's really many times a very quick bond. We have the Quilts of Valor program that we do every year. Even in COVID, we did it. And these are homemade quilts that are given to each veteran here in the facility. Their family accompanies them. We honor that veteran by telling very special stories about that veteran. And the family also helps us with that narrative since they know the veteran so well. We also have recreational activities in collaboration with community organizations, like all the different veteran groups. All I can think of is Judy Barnes, one of our most amazing volunteers, and she knows every veteran group there is, and there are one's more generous than the next. And a lot of our programming did go more virtual during COVID, and we are bringing things back incrementally and very in a very calculated fashion so that we can continue to mitigate risk of COVID-19. Next. I just want to stop and pause here to see if anybody has any questions before we talk about the admission process. Any questions about our programs or our facility? Okay. If you or someone that you know or a client that you have, a family member perhaps, is interested in exploring admission here at the John Levittow Healthcare Center, there's an application process, and we have a dedicated professional here, and her entire job is just helping to guide families and others through that process. So some of the just core functions of the application are a medical certificate, which a physician has to complete, the DD-214, which is the military discharge papers, a financial disclosure is required, and insurance information and federal VA documents if applicable. It's really important that the application is completed in full. Usually people don't get it all in on the first round. It's a lot to pull together, so we tell people send us the documents as you can, and we'll keep a file for you. And we'll work with you to be able to get the documents, the more documents that you need. And once the application is then received by our admissions office, the medical team reviews the clinical needs and the status of the applicant. So what we want to make sure we do first is we want to make sure that whatever medical needs this veteran has, we're equipped to handle. Because really the worst thing you could do is to admit somebody that you can't manage. And then you have a frustrated veteran, frustrated family, and staff that, despite giving it all of their best, we're just not equipped to handle certain types of illness or statuses. So we take a pause as soon as we get all the medical information. And often a person would be asked for very current medical information. We like a medical history, but we need the actual current status of the patient. You know, are they on IV antibiotics for a wound? You know, we don't do IVs here right now, so that's not somebody that we can handle. We do a lot of wound care, but we want to make sure that we have all those special products that you might need for that wound. So sometimes you can be medically approved, but we just have to wait to get your special supplies in. It's been a little bit tricky with COVID because the supply chain is a little more intermittent than we're accustomed to, but overall, we've been very fortunate in getting everything that we need. We work in conjunction with the Office of Advocacy and Assistance. The DD-214 is forwarded to them for their verification, and they make sure that it's legitimate and then it is accurate and will work for our facility. The financial disclosure and insurance information, we work in conjunction with our fiscal team, and they pay attention in great detail to all the fiscal components of an application. So we have to get approval from OA&A, we have to get approval from finance, and we have to get approval from the medical team. And all of these efforts are done in parallel. We don't finish one and then start the second phase. We're trying to do it all at once so that we can be as efficient as possible and respond back to that candidate that's looking for admission. So every department provides either their disapproval or their approval to the admissions director for each component of the application. If disapproved, further information may be requested. Sometimes people have a medical condition We're not sure if we can handle it. We're going to continue to ask for information. Our goal is to admit any veteran that needs to come here. But as I stated, we want to make sure that we have everything we need to do that. And then if approved by all parties and the patient is ready for admission, we schedule a date, we work with the family, and we have the veteran join us here on campus. And most of them are super happy when they get here, by the way. Some are also very relieved. So one of the most popular questions that we get is, who's going to pay for my relative or my client to be a patient here at the DVA? And a lot of folks think that because they're veterans, they can come here and there's no fee. And I wish that's the way it was. But in reality, and you can see on this slide, there's 4 different payer sources. And in order to be admitted to our facility, you have to be able to have a payer source that's approved by our fiscal team. And I'll go through them briefly. Medicare is a federal entitlement for those beneficiaries that qualify. You typically get a maximum of 100 days per spell of illness, and most patients do not reach the maximum of 100 days. They might reach 20 or 30 or whatever it is. It's not like you get an automatic 100 days. There's Medicaid, also referred to as Title 19 or welfare, and you must meet the asset and income requirements. And the application process goes through the Department of Social Services. So one thing about the DVA, we work with a lot of other state agencies in meeting the needs of our veterans. We can't approve or disapprove a Medicaid application here. That's all through DSS. Another method of payment is through the federal VA, but the veteran must meet the VA service disability requirements. So that all gets processed through the federal VA. Again, we don't have the ability to approve for federal VA. That goes all through the federal VA. And I encourage people to, if you think you or someone that you're caring for might meet some of the disability requirements, I encourage people to reach out to the federal VA sooner rather than later to get that ball rolling. It's not like an overnight process. It takes months in many cases. So I always encourage people to get started with that process if you think that that's the trajectory that you're on. And then there's private pay, where a veteran can pay out of their own funds. And if you're interested in admission, there's Linda's information. She's our director of admissions. Or you can just call the main DVA number and ask for healthcare admissions. And Linda is fantastic at what she does. She will help anybody navigate this process, which can be quite cumbersome if you've never done it before. But we have done it. Linda's done it probably thousands of times in her life. And she's a real pleasure to work with, and I would encourage you to call her if you feel so inclined. So I'd like to open it up for questions now for anybody who is in attendance. Any questions? There's usually a lot about the payment or the payer source. Everybody always asks questions about that. Roger, I see your hand up.
What specifically are you looking for on the federal disabilities, the federal VA disabilities?
You know, I don't speak for the federal VA because that's not my area of expertise, but they look at any disabilities that are related to that, typically of being a veteran. And I don't know the entire list of disabilities, but what I do know is that you can get certain percentage for certain things. So let's say you have, I'll use hearing loss as an example. If you have a certain type of a hearing loss, then that gets you like a 10% disability rating. And you can have other issues and a percentage is assigned. And if you get to the point where you're 70% or more disabled, the federal government will pay for your stay in our facility.
Okay, so it's based off the federal disabilities, not per se like your activities of daily living type stuff.
That's correct. It's based off just the disabilities, not what your needs are.
Okay. Sounds good. Thank you.
You're welcome. And then I see a J. Marshall. I don't know if that's a Mr. or Mrs.
It's Joan.
Joan.
I'm wondering about how long someone would wait if they submitted an application now. I mean, I know you can't be too specific, but ballpark.
Do you, an application for admission to the facility?
Yes.
Okay.
Yes.
So the answer to that is it depends on the current status of the applicant. If they already have a payer source and they have a medical condition that we can manage and it's sort of straightforward, it's a matter of a few weeks to a month.
Okay.
If there is no payer source, it will depend on which path you're pursuing as to how long it might take to get approved.
So if we're helping someone and the VA is where they would like to go for skilled nursing care, we should encourage them to complete a Medicaid application simultaneously with their inquiry to the VA, if they would qualify.
If they would qualify and if they're not pursuing federal VA service-connected disability. Although we do have many guys, we also have 3 women that live here, by the way. We do have veterans that have their service-connected disabled, 70 to 100%, and they have Medicare, and some of them also have Medicaid. So you can pursue multiple payer sources.
Okay. Okay. Thank you.
You're very welcome. Are there any other questions from, yes, I think that's Roger again. Roger?
I came in a little bit late, but what is your census that you have there at Rocky Hill?
We have 125 beds in our facility.
Wow, thank you.
Mm-hmm.
All right, Emily, we have Emily here as a moderator as well behind the scenes. I think Laura, I think we're all set to be able to transition to residential at this point. Thank you so much, Laura, and thank you for the great questions for everything.
Sure, thank you.
Yeah. Emily, are we ready to move on?
I believe so. I just wanted to say that Anne did put out there, Anne is the presenter after, she's the VSO. She said, just to clarify, 70 to 100% for service-connected disabilities are needed for the VA to pay for contracted care.
Mm-hmm. That's correct.
Thank you. Thank you so much, Laura. Very much appreciate the great information. So we'll transition to the residential facility and housing. Once again, I'm Leslie Nieves, I'm director here at this facility. It is to me an honor to be here presenting this details about what we have to offer in my facility. At the residential facility, this is considered more of a transitional housing program. We provide continuum of wraparound rehabilitative services, programs designed to return our veterans back to independent living. A caveat to this is that our resident veterans have an admission date, but they do not have a discharge date. Some come and stay a few months, some come stay a few years. And we do have veterans right now that are pretty much what we consider to be aging in place. Those are the veterans that are pretty much here long-term, but they're still able to take care of their own basic needs on a daily basis and able to still meet that criteria of independence as is described as skills of daily living, independent skills of daily living, and take care of their affairs. They need some assistance at times, and that kind of speaks to the staff that's here on site and available that I'll speak to here in a little bit. But really the goal here is to work with our veterans that come to us for various reasons: homelessness, substance abuse, mental health issues, estranged issues from families, and the sort. But it's really to develop a rehabilitative plan to basically get them back into the community sooner than later, with very specific goals and objectives to get them there, and removing the barriers to be able to achieve those goals. We also have, besides the residential facility program, I also manage a Patriots Landing temporary housing program, and this is designed for families. Families, and we have 5 homes, or we call the 5 houses across the street on West Street here in Rocky Hill, which they are presently full, and which is a great thing. We want to keep them full all the time, but the program is designed to be temporary, and families come able to be here for up to 2 years. We have a partner in collaboration with Chrysalis Community Center that provides an ongoing case management with the families to assist us and eventually get the families transition back out to a sustainable housing, permanent housing type of situation. Next slide. In the residential facility, we currently, and just a correction on this slide, we actually have 4 wings that have been set up as semi-private wings, and a couple of them that still remain as 4 residents room, but most of our wings have been transitioned to semi-independent, with only having 2 residents to a wing. And this is a relatively newer design for us. We transitioned our first wing back in 2019, so we've had a couple years that have been transitioning our wings, and really has, I would say, overall lends itself to improvement in the overall quality of life of our residents being here in my facility. Some general items that, furnishings in these areas, you have the bed, the desk, the chairs, and the lockers, but in the semi-private rooms, you have more furnishings such as a nut table, a sofa, and a couch, and reclining chairs. It makes it very much of a homey environment. Along with these 7 wings, and those 7 wings are specifically for males here, and we also have a designated female wing, which is E-wing, and that currently has a capacity to be able to accommodate up to 12 females in that wing. In our program fee, the cost to be here, and recently there was a change and voted by our board of trustees. It has been 30%, but this is going to be changing effective October 1st. The reduction is going to be going down to 25%. We do have a veterans outpatient clinic, a fully licensed staff clinic 5 days a week from 7 in the morning through 3 in the afternoon. Veterans are able to care for the health needs, but this is a collaboration, just like Laura indicated, in the healthcare center. We also in my facility collaborate extensively with the federal VA, in which many of our veterans have their primary care providers out of the federal VA between West Haven or Newington. During the COVID-19, like many other facilities of communal living, have been challenged by this process, and in the efforts to be able to mitigate the ongoing risks related to the pandemic, we're able to stand up an isolation and recovery unit, which is part of our facility here as well, and that is our A wing. In the Patriots Landing program, those homes are fully furnished, and that's one of the great benefits that our families coming to us. Pretty much they apply, they get selected, and they're told you're coming into a fully furnished home, and that everything is pretty much provided. The first 3 months, they don't have to pay a fee. After that, they pay a flat fee of $200. So it's a great deal. All maintenance issues are taken care of. We provide cable services in the home, which is basic cable, but still everything is included in that cost. Next slide. Next slide, Ann. Okay. Briefly on the semi-private living program, which, like I mentioned already, was established back in 2019. We have been moving towards this model, ultimately being able to have the whole entire facility, all the wings, to be semi-private, only having 2 individuals to the room. Like I said, it really has improved the overall quality of life in the environment for our veterans that are here as well. And the feedback has been very positive overall. One of the things that's also unique to the semi-private living program is that veterans are expected to be able to do chores and provide ongoing daily upkeep and support and maintenance of the wing. And that has also been very positive in that, veterans feel good about contributing to the overall upkeep and maintenance of their wings. And the renovations, with the new furnishings, that the veterans continue to take a lot of pride and enjoy the new accommodations and new furnishings overall. Next slide. This is just some pictures of the overall of the spaces, living spaces. Additional program and services provided in supporting our veterans is a vocational rehabilitative program that include educational services, employment, search assistance, veterans vocational and therapeutic program, which are able to participate in that specific program up to 24 months, sometimes longer, based upon specific therapeutic needs that a veteran may have. And my rehabilitative counselor, which here is Chuck Leon, he works very closely with other community agencies or other state agencies, such as Department of Labor. We actually have a representative that comes here for the Department of Labor once a week, and ensures that our veterans are registered with the Connecticut Hires program. We have two social workers on site, as well as case management. This is an ongoing, collaboration process in engaging our veterans to make sure that their overall mental health, emotional needs are being properly met. And a lot of times, besides the social work support that our veterans receive here, they're connected with ongoing supports, mental health services, and substance abuse services out at the federal VA, and sometimes with community agencies. Along with that, we also have the Department of Mental Health and Addictive Services that are here, part of our Veterans Recovery Center that we have on site, and that level of substance use intervention of services is more on an outpatient level. If a veteran needs higher level of care, such as an intensive outpatient or inpatient care, we coordinate that effort with the federal VA and to be able to get them to the level of care that they need. Other collaborative partnerships, I already mentioned the Department of Labor. We have the Connecticut Veterans Legal Center that also comes here once a week. A lot of the legal issues that come up in dealing with our veterans, let it be evictions, child support, other minor legal issues that they have have going on that can be intervened and be able to get resolved. Sometimes our powers of attorneys or financial issues or bankruptcies and things of that sort. Debts that the veteran may have. We also collaborate with the Department of Social Services as to being able to get our veterans to be eligible certain levels of care and services they might be eligible for. Another one is Easter Seals Veterans Rally Point program that provide ongoing support and coordination of, when it comes to housing, employment services as well. Recreational activities, we do have a recreational therapist on here, and also, like Laura mentioned, that we have a lot of great partners out there in the community that provide a lot of wonderful opportunities for our veterans to take part in community recreational activities. Just for an example, this past week, last week, we had the Veterans Appreciation Day, the Yard Goats game on Saturday. We had the Big Eat Veterans Day on last Friday. Then we had the Black Hawk fishing trip, which was a huge one. So it was a huge week last week for our veterans here, and they welcomed that overall. It's a very positive experience, and a huge trip that we had a couple years ago in 2019 that we took 24 veterans down to the Washington, D.C. to visit all the monuments, and that was quite a trip, and quite exciting for all the veterans that partook in that. We have a Veterans Fitness Center here as well, fully equipped. We also provide transportation services that includes veterans that are going to school, that are working, and also to their medical appointments, shuttles that go to Newington VA or West Haven VA, but also to medical appointments that veteran might have out there with community providers that the federal VA partners with. Next slide. This is just overall pictures of our areas here. As you can see, just some of the spaces, the fitness center. We have a Vet Connect where computers are set up for the use of our veterans, as well as the samples of our day room. Next slide. I already spoke a little bit about our Veterans Outpatient Clinic. And this is really key because it really helps, especially our veterans that are aging in place or here, what we call it long-term, and helping them manage their care. We have veterans that are required to have, pill boxes, and we assist them with setting them up with that. They also are able to triage and assist veterans that might need to go to higher level of care. And I tell you, with our Veterans Outpatient Clinic here during this pandemic, they have been a vital asset here on site when it comes to ongoing testing, ongoing monitoring symptoms of our veterans and being able to, get them tested, getting them screened, and isolate them when it's necessary to do that. So they have been an invaluable asset here in being on site and providing the support necessary to our veterans overall. Next slide. Just some events in the past year. We'll just go through these very quickly. So we have about 15 minutes after. Go ahead, Ann. Just similar to Laura, we have a lot of ongoing events that we do throughout the year, honoring Veterans Day, Memorial Day, Flag Day, and things of that sort. So we really try to, honor the special events throughout the year for our veterans and have very good participation, not only of the veterans here, but also from the community as well. Next slide. Donors and huge, and volunteers. During the pandemic, we have seen an outpouring of support to our veterans here when it comes to simple things, K-cups or the Keurig machines or just snacks and things of that sort. So we're very, very fortunate, very grateful for the ongoing support that we receive and the donor support during this past year. So I tell you, it's amazing what the community will do in coming together and supporting our veterans. So we're very grateful here. Next slide. More of the snacks and the water. Next slide. Similar to Laura, we also have a Quilts of Valor presentations that we do to our veterans. Once again, very, very special and very valuable in recognizing our veterans. And this is a recognition to our president of the Veterans Council. They stay very active and engaged and just in ensuring that we're meeting their needs. So their voice matters and letting us know and speaking up as to things that we can do differently and overall meeting the veterans' needs in the community here of our veterans as well. This was part of the pandemic ongoing COVID screen. We do had the screens that were done by the Connecticut Army National Guard and the ongoing testing that was done by Griffin Hospital. Next slide. And this is standout from last year, but this year, as we are here looking at standout for 2021, really excited and to share that as of right now, we have over 700 individuals that registered to come out for the Day of Services on September 24th. So last year, it was very successful, and we hope to be more successful this year. This is how we can be reached. Our applications for this facility, you can find them on our website, but you can always call me here directly, Leslie Nieves, at 860-616-3801, or my admissions coordinator, which is Carol Gretorix, at 860-616-3802. But you can find all our information at our website. Thank you. And I'll be turning it over to Ann. Any questions for me? And I know I went through it very quickly, just trying to be honoring the time that we have to complete this presentation and allow time for Ann. Any questions? No? All right, thank you. I'll turn it over to Ann. I think Ann has to switch out the slides. Ann, you're all set?
Yeah, sorry about that. I had to just toggle over there. Did it pop up? Everything good?
We're good. Thank you.
Okay, great. And okay, so I'm stepping in for Ryan McKenna, who is the director of the Office of Advocacy and Assistance. He's on orders, and so I'm one of the veteran service officers for the 3rd Congressional District. We are the Office of Advocacy and Assistance within Connecticut Department of Veterans Affairs covers the veteran service officers, as well as the Connecticut Veterans State Cemetery System. I think somebody else is going to talk more about that. But we have 4 core functions on Connecticut's campus here: the Levittow, which we've already heard about, the residential facility, again, heard about it. Then there's us, advocacy and assistance, and cemetery and memorial services. So the veteran service officers are accredited by VA General Counsel, Washington, D.C. to assist veterans with filing claims for service-connected disability compensation, as well as veterans pension or survivor's pension. Real quickly, we coordinate and submit those claims, prepare, present, and prosecute those claims to the federal VA. But we do lots of things to help veterans. Basically, we identify anything that they need, which is kind of what everybody does at Connecticut Veterans Affairs, who's in any kind of service. You find out what it is a veteran needs and you try to help them get it or get with the people who can help them get it. So we have partnerships with community providers, vet centers, nursing homes, and we'll refer for education and training to Department of Labor, Health and Housing Services, Employment Services, Department of Labor, and also discharge upgrades. We divvy up the state by congressional district. I'm in the 3rd. We have VSOs in all of them. Emily, who's moderating this, serves the 2nd. Here's all the contact information for each of them. I'm sure these slides will be made available if anybody on the call needs this information, but you can always find it by checking out the portal. But those are our contact numbers there. So that's sort of our bread and butter is service-connected disability compensation and non-service connected pension. In order to file a claim, you'll want to contact a VSO, and the VSO will go over and tell you everything you need to have a successful claim. And this is really, you know, a general overview here. It's not by any means detailing all of the work that goes into a claim, but you're going to want to, you know, again, provide supporting medical documentation. Perhaps you'll be called in, the veteran will be called in for a compensation and pension exam. And, you know, your VSO will assemble all the proper forms, make sure there are no errors, omissions, or questionable items, and submit that to the federal VA. And then, as Ryan says, we got to be patient. It can be a frustrating process. It's frustrating for us too. But in as much as you can load the front end by getting all that supporting documentation and fulfilling all the principles of service connection before you turn in the claim, it'll be that much more speedy of a decision. But that's kind of the bread and butter of what we do. There are a number of state and local benefits that are good to know about. I hope that most people listening are aware of the tax abatement that's available to veterans. Each municipality has the ability to decide how generous they're going to be. So one town might offer more than another, but that's up to them. But all veterans are encouraged to bring a DD 214, and if they are service-connected disabled or even receiving pension benefits, we want to encourage them to bring to the tax assessor's office their statement of benefits. In which case the town will give them a little abatement in their property taxes. So veterans who have, at least 90 days of wartime service during World War II, or even served in the Merchant Marines are eligible for a $1,500 exemption for property taxes. So that's a helpful thing. Veterans below a certain income level or disabled veterans are eligible for additional property tax exemptions. and surviving spouses maybe as well. So definitely contact your municipality's tax assessors. We have a great tuition waiver program in the state of Connecticut, where tuition is waived for wartime veterans. However, tuition, and that's great, but not books and fees. There are certain other fees that are not covered, but hopefully if a veteran has a GI Bill or vocational rehabilitation benefits, they may be able to have that much more sort of left over from their GI Bill or voc rehab in order to help pay their living expenses. So that's a great thing. There's many philanthropic organizations, not the least of which is the Soldier Sailors Marines Fund for veterans in sort of having financial crisis. Usable once a year, excellent and very helpful to folks. For employment purposes, there's veterans preference points. That an application to the federal, a federal application for employment is sort of graded, and if you are a veteran, it gets you some extra points. If you're a disabled veteran, a few more points, and so that's helpful. State employee retirement benefits. There's veteran-owned micro business preference. I'm going to have to defer to any questions about that to Ryan when he returns. I'm afraid I don't know a ton about the micro business preference, so I'm sorry, but I do believe he runs that program. So I'm sorry, I'm out of my depth there. So a few more Connecticut veterans benefits: DMV registration and fee exemption in certain instances. For those veterans who were drafted before they were able to complete their high school diploma, we're able to get them those high school diplomas. Burial in the State and Veterans Cemetery, Connecticut State Veterans Cemetery. Again, I believe somebody's going to talk more about that, I think, but we have a really lovely Connecticut Veterans Cemetery in Middletown, Connecticut. A lot has been done to improve it and to expand it. And again, this isn't my area of expertise. I just know that as a Connecticut veteran, as of about, I don't know, I'd say about 15 years ago, 15, 20 years ago, I wouldn't have wanted to be interred there. But subsequent commissioners have really made it their business to improve and expand it. And it's lovely now. There's a columbarium for cremains, niches for cremains, and the landscaping is much improved. And again, there's things that are beyond my ken about purchasing extra land. And I'm sorry, I'm going to have to defer to somebody who knows more than I about that. We also are happy to give honor Connecticut veterans with the Connecticut Wartime Service Medal. Any veteran who served during a wartime is eligible for it. Here it is. It's a good, a beautiful medal, and it can be a very touching and meaningful ceremony when we have those Connecticut Wartime Service Medal ceremonies. I guess I am going to have to talk a little bit about the cemetery and memorial services. I don't know, is Pam or Kendra on here? I don't know. I don't think so. All right, well, you're stuck with me. We've got 3 state cemeteries one in Darien, one Rocky Hill, one Middletown. I believe Darien has been closed and not receiving any internments for quite some time. I'm not sure about Rocky Hill. And then, of course, I've told you about Middletown. I'm not sure why this is in here. I mean, this is kind of a breakdown, but I'm sure everybody on this call is somewhat familiar with how the federal VA breaks into three main branches. There's the Veterans Health Administration. That's what people think of when they think of the VA hospitals, right? And the CBOCs, the community-based outpatient clinics. That's the Veterans Health Administration. Then there's another lane, veterans benefits. That's what I refer to as the money, right? So that's benefits like service-connected disability compensation, veterans pension, and also insurance, education benefits are all handled through VBA. And then, of course, the third is the National Cemetery Administration. So, you know, when you're thinking of Arlington and the national cemeteries, that's the three main branches of the Federal Benefits Administration. Many people get mixed up thinking that, you know, the VA is all just one thing, but it's actually three distinct branches. And they also get confused with Connecticut Veterans Affairs being the same thing as the Federal Veterans Affairs. But we, of course, are a state agency, and we help you get your federal, state, and local benefits. But we are a different entity. As far as the federal VA healthcare goes, we've got the West Haven VA, we've got the Newington VA hospital, which is also the site of our regional office. We've got the CBOCs, community-based outpatient clinics. You can see there are a number of them and all of the different locations sprinkled throughout the state. In West Haven, we have the Aurora Community Care Center. It's for veterans who are struggling with substance use issues and homelessness. And the Aurora helps get you into supportive housing. They help folks with VASH HUD vouchers. It's a comprehensive organization and helping people with veterans with those particular issues. And then, of course, vet centers. So that's another thing that gets confusing, I know, to a lot of folks who don't work within the VA system. They hear VA, vet centers, Connecticut Veterans Affairs. It all sounds like the same stuff, but actually vet centers are counseling. They do just counseling. They're located off a campus. They're not located at the VA hospitals. They're freestanding places that counsel veterans who are combat veterans. They do have some ability to counsel people, family members, perhaps, of veterans. If there's couples counseling or family counseling that's needed for a combat veteran. So, they will accommodate that. But they're excellent, and we work in partnership a great deal with them. So that is the end of the slides that Ryan gave me. I don't have a little question slide, so I'll just ask you if, whoops, that's my alarm to log out. I'll ask if anybody's got any questions at this point. Let's see, in the chat, I can see somebody typing. Not sure if it's a question or not. But Okay. Okay. It says, Bill asks, can I elaborate on the DM exemption? DM, I'm sorry, tell me what that refers to. You could unmute, Bill, and just ask if you like. Oh, DMV. Yeah, thanks. Yeah. Oh, did I skip over that one? Probably because yeah, I'm gonna say I'm gonna have to find out more about that and get back to you. I do know that you know, certain certain fees can be waived for returning veterans or veterans who are deployed and are missing deadlines to renew a registration, things like that. That there are exemptions, but I'm sorry, I don't know everything that entails. Is anybody on here, Emily or Lesbia, that might know?
Depending on, go ahead. I haven't. So I just wanted to comment that for like active service members, if you're active duty, there's sometimes an exception. It could be made for your license fee. So just like there's various different criteria, but if you have a specific questions related to that, you can definitely put it in the channel. We can get an answer for you, Bill, and get back to you. Because we do have a very strong collaboration with the DMV, and some of the programming has been changing as we speak. You know, such as having the veteran status on the driver's license. You know, they're in the process of changing. You know, on the license plates as well to be recognizing various conflicts. But that there's different types of criteria.
Thank you. Yeah, I think this might be mostly referring to those veterans who are deployed or just returning from deployment who might otherwise be subject to fees, or who are just coming off active duty. Certain fees may be waived. What's up, Roger? I see your hand up. You could just unmute and ask.
Yeah, can you talk about what is the Connecticut Veterans Registry?
Oh, well, we keep a sort of library of all of the DD 214s of all Connecticut veterans that we could possibly get our hands on. You know, certainly as VSOs, we need that to file a claim for service-connected disability compensation, but we try to keep a registry of every single one and keep it on file for us, in the same way that a municipality would keep something on file from, I don't know, if the town was incorporated in 1700, they've got a document, they keep it, right? So that's kind of what we're doing with DD 214s. We're just trying to keep a library of every single one, because sometimes it's difficult for people when they're trying to apply for benefits, family members, to locate that. Veteran might not have that in his possession, and getting it from the National Archives might be problematic for any number of reasons. And if they can check with us, if we have it, because they've come into contact with us either through Rocky Hill or through filing a claim, in any number of ways we might have that, we can supply that to a family. And it's really nice, because as we all know, I mean, I think anybody in any kind of government service delivery job, the paperwork that's required is usually voluminous. and it's overwhelming to families. So if we can help them in this small way, it's, you know, nice for them.
Alrighty, so we're a little bit over, it's 4:35 unless someone else, Roger, did you have another question before we wrap up?
Yeah, am I to understand the DMV will be at the various sites on Friday?
Yes, sir.
Thank you.
Okay. Emily, are we all set? Any other questions in the chat that we need to address before we close out?
No, but Ryan Berry did put up the link for DMV for the military personnel registering a vehicle in Connecticut. So if you'd like to go there, he provided that link to us. So that's great.
Excellent. Thank you. Well, thank you, Emily, for moderating. Thank you, Laura and Ann, for sharing this information, and for all the audience today and being able to take this information with you. Of course, we're all here available, reaching out to us, any questions that you may have as we continue to meet the needs of our veterans across the state. We're here and more than able and willing to assist our veterans. So take care and thank you once again. I hope to see many of you hopefully in various sites on Friday. Take care and have a good afternoon. Thank you. Take care. Bye-bye.
Thanks, Leslie. Bye.
Bye-bye.
Thanks, Leslie. Thanks. Bye-bye.